Hello, everyone, and welcome to today's industry webinar, RHC Assistance Updates. My name is Ellen Knowles. I am the Marketing Communications Manager here at Azalea Health, and I will serve as your moderator for today's presentation. Before we get started, I'd like to go over a few items so you know how to participate in today's event. Everyone on this call is listening in using their computer audio system by default. If you would prefer to join over the phone, just select telephone in the audio pane on the right-hand side of your screen, and the dial-in information will be displayed there. You will have the opportunity to submit questions during today's webinar by typing your question into the questions pane on your control panel. You may send these in at any time during the presentation, and we will address them at the end during Q&A. Also, please note that today's slides will be shared in a follow-up email, as well as the recording of the webinar, so you can review again or share with any of your peers. I would now like to introduce our presenter today. We have Helen Williams, Azalea's Strategic Healthcare Consultant. With that, I'll go ahead and turn today's presentation over to you, Ms. Helen.
Thank you, Ellen. And thank you all and welcome again for joining us today. I know that your schedules are very tight right now with lots going on in your practice, so I really appreciate you taking the time out to try to keep up to date on the industry changes. I hope things are starting to get back to normal just a little bit, whatever normal is for a rural health clinic, but I'm sure there must be some somewhere. So I'm hoping things are returning for you and doing better. I do want to start today to talk to you for just a few minutes about the latest payments that we received from HHS for our rural health clinics. But I do want to make sure that I preface this by saying, as you all know, all the information right now coming down from the CARES Act, from COVID, changes from day to day. So please keep in mind, this is the best information I have right now. So if you find something that differs, I urge you to go out to the websites and check that out, because I may have old information. I hope not, but that does happen. I wanted to talk about who's eligible to receive those funds. Hopefully now, by the end of May, you should have received, in the last week of May, you should have received a payment that came out to you for approximately $50,000 coming out into you. And that payment went out to all rural health clinics. What they decided to do with the money that they wanted to split for the rural health clinics was, rather than trying to look at the size of the clinic and base the payment on a percentage of patients seen by that clinic or the population in that area, they would just split it evenly with everyone. So if you were eligible for on CMS file as a participating rural health clinic, meaning you had an active CCN number and you were set up in the system as a rural health clinic, then you should have received that money coming out to you. Now, the only exception to that is perhaps in the last, say this was around I think the last update I saw was May 1st, somewhere around there, end of April, 1st of May on those files. So if you were newly certified in the last 30 days, maybe it didn't get there yet. But other than that, you should have received your money. Next slide. And as I said, the money would be distributed in approximately $50,000. I think it was like $49,600 and some dollars to be exact. And that money was solely for the purpose of COVID-19 testing. HHS felt like, as always, which is good, we as rural health clinics have a open relationship with the community, meaning if a patient's sick or if a patient wants to know about some type of crisis, whether it be flu or whatever that's going on, they usually come to our clinic. So they felt like giving this money to the rural health clinic, helping us to be able to provide testing, would be a great way to be able to keep their finger on the pulse of what's happening. Are our numbers going down? We've heard a lot about the curve. And are we treating those patients? Who's being tested? Who's not being tested? So it was really a great thing. The money should have been deposited directly into your bank account if you receive payments electronically from Medicare. Now, the only difference to that would have been if you had update changes like ownership changes, TIN changes, maybe the system wasn't updated. So if you didn't receive your money, please don't hesitate to contact them to ask. The one other exception that we'll find to that is if you're an RHC and you're a provider-based RHC, meaning you have a parent company or a hospital that you're a division of or a part of, then the hospital probably received those funds for you. So you might want to just check just to make sure that they did get that money. That does happen sometimes. If you do not have electronic funds transfers set up, meaning that your bank account and your TIN is not tied for automatic payments, then you would receive a paper check. The paper check process does take a little longer. I've heard some folks tell me that it's taken as much as 15 days for them to get a paper check. So as I said, again, go ahead and check that out to see if you've not received yours, what might have happened or what might have gone wrong. Next slide, please. I wanted to spend just a little bit of time talking about how we can use this money. This money's not to pay old bills. This money's not to pay payroll, anything of that nature. This money is set aside strictly for COVID-19 testing and any type of expenses associated to it. Now, you could use it if you had past invoices for some COVID test kits or for some PPE that you needed for it, or maybe some changes that you had to make within your clinic, meaning you wanted to split the waiting room or split, a separate entrance to bring patients in who were sick so they didn't contaminate other patients in the lobby. So if you have receipts and you have things of that nature, you could pick up old expenses from that. But most of this is going to apply just for your actual testing and anything associated with it. Now, that could be training your providers, training your staff. Many of us are seeing patients where we're going out and we're doing screening in the parking lot. So we've had to maybe add an extra staff member or somebody to help us to change our workflows to be able to accommodate for that. So those type things you could use that for. Also, as I said, you could order PPE supplies from that. I know that we're all spending lots of money on that now and our expenses have gone up. So you could use it for that and as well as for the test kits. The one thing I do want to caution you very strongly about is making sure that you have a good record keeping system for these funds that you're using. You can do it any way you want. If you have QuickBooks, you can use QuickBooks. Maybe you have an accounting system within your software system that will allow you to do that. But I would urge you strongly to keep those expenses recorded. And some of my clinics are even going to the point now that they're recording the expenses and they're attaching a PDF file of a copy of the receipt to it. So in the event that an audit should occur, everything's right there at their fingertips. They're not having to rummage through receipts and through checks and so forth and try to figure out who was paid for what and what we use that money for. So there are a lot of ways that you can do it. But I think the more time that we spend now up front with it, the easier it will be. I do feel that at some point, although no one's ever said this yet, there will be some reconciliation and there will be some audit on those funds that we're going to have to account for them. So the more we do now, the better it'll be. Next slide, please. There are conditions and terms that are attached to this money, as I'm sure most of you have been finding out by now. Hopefully now you've looked at the HRSA Cares Provider Relief Fund portal. I understand from folks, many folks have had trouble with it and difficulty, but I was out there right before the webinar and it seemed to be working fine. But I urge you to go out on that portal and just kind of look around. because once you receive those funds, you are required to attest to the fact that you've received them. You need to confirm, of course, the receipt of the money and the fact that you are truly a RHC that's certified and that you're in good standings with both Medicare and state Medicaid, meaning your funds have not stopped, you've not been put on hold for anything, you're not past due on a certification or anything of that nature. So you want to make sure that you do that attestation. The portal was pretty easy. As I said, I was out there just before the webinar, and it was it's HRSA Cares Provider Relief Fund. And it was step one was eligibility, where you simply just confirmed eligibility. And then step two was where you entered your billing TIN number. And then you moved to step three, where you would verify the payment information. And step four was the actual attestation. And don't forget step five, which is a confirmation. And I don't know about you, but with a lot of things changing right now, for me, I print down the confirmation page just so I know that I have it and I can attach that to my file to show that I did attest as I should have going along. I know we went through this kind of fast today, but I wanted to go back just a little bit real quick before we go to question and answers, just to make sure that we go over like some of the expenses that you can use this for, because I think it's really important to know, you know, that it's not just the test kits. I've heard from a lot of my clients that they think it's just test kits or PPE that we can buy. It's not. We can do other things with it. Like I said, we talked about the walk-up that we're going out and where we're testing people and we're putting an employee in the lobby and we're using special thermometers to do checks for the ones that we bring in and that type thing. We're also doing things like bringing in telehealth and so forth, and we can use that to purchase equipment for telehealth if we need to with that. And monitoring systems, so you can make sure that you can use it on things like that. Also, anything you need to do to your workplace to make the safety of a patient, the safety of your employees, to keep everybody safe, those type minor changes can sometimes be expensive with construction costs or splitting a waiting room for sick and well if we didn't have that before. So those type things you can use. Also, training your staff and your providers probably less so than the staff, but keeping up to date with training, you could do that with those. And then any type of outreach that you would do to patients, explaining to them, this is what we need to do, and this is how we're going to be handling these cases, and explaining to them the importance of getting tested and when to get tested. So anything you need to do like that. If you need to purchase a temporary thing like a tent or something, some people are setting up tents to do testing in parking lot and so forth, a temporary fixture of that, if it's just solely for the COVID-19, then that could also be used in that expense. Okay, Ellen, we can go ahead. I know we went through kind of fast to see if there are any questions. I'll do my best to answer them.
Yes, thank you so much, Helen. As Helen just mentioned, we are opening it up for Q&A now. It doesn't look like we've had any questions submitted yet. So everyone, please take a moment. If you have any questions regarding the topics that we covered today, feel free to submit those now. We'll take a moment and see if we get any submissions, and we can try to answer those accordingly. And while we wait to see if we have any questions come through, Helen, I wanted to ask, I know that you are speaking with rural health clinics all the time and getting a lot of their common questions. So is there anything that you also just want to point out that you haven't done so already on common questions that you've received so far?
I think one of the main ones is the setting up a system to be able to monitor and account for what you're spending and keeping track of the funds, because I do think that's very important. We all know that at some point we're going to have to do a reconciliation on that. And as I said, I don't think it has to be a real complex system. I think it can even be something as simple as a spreadsheet, an Excel spreadsheet where you list them, and then, as I said, just attach the PDF of the copy of the receipt, or make a special file folder or something that you put all your receipts in related to COVID-19 expenses and that money. I think that's the most important thing, and that's what I'm hearing the most from is, what can we spend the money on, and what do we need to do to account for it?
Great. Thank you for sharing that. That is great advice. Looks like we actually haven't had any further questions being submitted so far. So I think sounds like you did a great job at addressing all of that. Oh, here we go. We're getting a couple now that are coming through. So our first question asks here, we have been testing since mid-March and billing insurance for our evaluation of the patient. And our reference lab, Quest, bills insurance as well. So I feel like this money needs to be used for a different type of problem, such as return to work monitoring. So can the funds be used for returning to work monitoring?
Well, we can't go back and get those expenses that we've been paid for by another carrier. They're not eligible. But the return to work, I need to check that one, Ellen. I'm not real sure about that. I've not heard that one before. But if you have been paid by some other source, then you can't go back and use those expenses. But if you had testing that you did and that you were not paid for, then you can put those, even though they were prior expenses, back out of that fund.
Okay, so Catherine, let's follow back up with you on that question, just so we can try to better understand if the funds would be related to that returning to work. We have one question here that is asking, my provider was a co-owner for an RHC until November of 2019, at which that time she became the sole owner of the clinic. The appropriate paperwork was submitted to Medicare. However, there was a breakdown from Medicare to HHS in Atlanta, and the change of ownership was not completed until after the first two distributions of funds were made. So it sounds like they did not get the last reference fund of the 49,000. And so they've been trying to contact UHC, and they've sent certified letters to UHC and HHS. They've just not heard back from them. So they are wondering how they can reach out to someone to receive those funds.
Okay, I'm going to give you a phone number that is a provider support COVID-19 phone number that you need to call. It's 866-569-3522, and I'll give you a little tidbit. You may have to keep calling and calling because trying to get through is difficult, but I would call that number and start a case file with someone.
Okay, great. I just I typed that phone number in the questions pane to Brenda, who submitted that question. So Brenda, if you want to reach out to that support number and see if you can get some. Okay, looks like she just wrote back in. She has tried to reach out to that a few times. So seems like maybe that's something that I'm sure there's many people calling. So it may be one of those where you have to try several times to get through. But we can follow up with you separately, Brenda, and see if there's any other resources we can try to help guide you to.
I was going to say, you could give her my contact if you want, Ellen, and I'll be glad to try and help her too. I know that they were having some problems with the phone lines and with the portal as well. But as I said, I tried right before the webinar and I didn't have any problem. That's not to say that you'll be able to get through right now, Brenda, but maybe there's a break.
Yeah, so Brenda, we'll follow up with you after this today. We have one more question that came in regarding if they were to buy an iPad so they can allow patients to check in and from their car, are they able to use the money to buy those type of tools?
It does say that you're able to use the money for software. It does say that you're able to use it for equipment such as telehealth equipment, temporary or non-fixed barriers, and vehicles to transport, and then health information technology and digital tools. So I would say yes, that you could.
Mhm. Yes, I think as long as you're documenting how it's related to a COVID type of expense, probably.
Yes, and anything you do that's out of the ordinary like that, you want to make a reference file because, it may be 2 to 3 years from now that they come back and actually audit those funds, and you won't remember what actually happened during that time frame. That's why I suggest starting a paper file. I know no one likes paper, but then if something happens and there's a change in management, that information is available for whoever takes over in the clinic.
Absolutely. Thank you for answering that one. Let's see, we don't have any more. Let's just wait another couple seconds here, see if we get an additional question submitted. All really great questions so far today. So thank y'all for taking the time to submit those. All right, it doesn't look like we're getting any further questions. So looks like we've probably covered most everything for today. We do have a couple of you that we will follow up with separately and see if we can provide some further information. But for now, I will go ahead and conclude today's webinar. I want to thank you, Helen, for presenting. And as a reminder, today's slides will be shared in a follow-up email, which will also include a link to the recording in case you want to review again or you can share with any of your peers. On behalf of Azalea Health and our presenter, thank you for joining us, and I hope you all have a great rest of your day. Thanks. Bye-bye.
Thank you.